Um, Katie, can you hear me? Yeah, it's on now. We're going to be just a few minutes before we begin. We got a substitute coming. It should be here in less than 10 minutes. Okay, I think everyone on the committee has got the substitute. Um, if y'all are ready, we'll go ahead and begin. And I will ask Sherry Gillen, if you will say the prayer, please.
Thank you, Mr. Chairman. Dear Heavenly Father, we thank you so much for this opportunity to be here in this room, to gather testimony, to hear what needs to be brought before the state. We ask that you give us wisdom and guidance and grace as we go through this. Be with everyone here and bless us. In your name we pray. Amen.
Thank you, Representative Gilligan. If Representative Dempsey will come forward and present your bill. We are considering, go ahead and read this. It's LC 33777-0S. Is that, everyone on the committee have this? Yep. Okay, it's all yours. Yes.
Thank you, Mr. Chairman and members of the committee. And I apologize, you're getting a very fresh, hot, out of Legislative Council copy. Thank you, Tara, for your quick work, too, to make it all work. But that's what we do here, right? We make things work, without a doubt. So today I bring you, and you previously saw a bill, I believe, that was called the Strategic Integrated Data System. And you know, that's not a very good acronym when you look at it, SIDS. So first of all, your brand new legislation that is in hand there is for the GDAC, Georgia Data Analytics Center, a much better name, as well as it really better describes what it will be doing. So what this bill, I want to start off first of all by telling you that we all talk about the silos of government. So the intent, the pure intent of this is to break down those silos, to find the ways for information access to be available in a quicker, real-time opportunity that we all need as legislators, that our governor needs actually for his work as well. So what this is going to do is to enhance the legislative policy decision-making process through actionable insight using the state of Georgia's own data. This will help us develop a cohesive policy approach around all constituent services, cross-agency, cross-program, centralized data repository is required to actually do this. Last year, we passed this bill, a very similar version, out of the House with great support. I believe it was unanimous. If not, it was almost. It did not move in the Senate at all. But I'm going to say thank you to them today for stopping it, because we have made it so much better, I believe, under Governor Kemp. This is going to be a great opportunity for each of you and for our state to change forever the impactful work that we do here for Georgia. I think it will go down for each of us that have the privilege, hopefully, of voting in the House, that we have changed. We have changed and broken down the silos in a very genuine way. I want to ask you to look at your bill, first of all, and just like pretty much standard of all bills, it will begin with definitions. It goes on farther to define the project. When you get to line 63, we're talking about oversight and policies. Moving on through it to 127, it gives the authority for the Attorney General's review if we should need that. At 142 for the reporting mechanism, and in 156, the funding sources to make this work. Had a lot of conversations with OPB on this, and I am very excited, and I genuinely think that they are, to look at this work and this possibility. It does four main things. It will give us timely and accurate access to agency data, cross-agency policy mandates to address issues facing Georgia that are so important. For example, the opioid abuse and child abuse, dealing particularly with our foster care system and many other entities there. To identify performance and cost metrics, so that as we actually do look at policy, we know what things really cost, what the true loss is, what the true gain can be, how we can best spend and save in the state of Georgia. And it gives us a real vision for our future. It's one thing to talk when we all get together and we talk about bills and we talk about legislation, and we're filled with passion and dreams of how to make Georgia better. I know that. But without the data to back it up, we're attempting, we're trying with the best of intentions. But once we can actually access real-time data, we can be actually affecting change and reality in a profound way. Before we have any questions, I just thought I'd like to let Director Rawlings talk to y'all about it. And I'm so proud of him. He's done a great job, and now he is one of the few people that have actually been sworn in, I believe, by Governor Kemp. So he has the authority to talk to us, too, about what his future may be and what he feels the profound importance, I think, of analytics is.
Thank you. Chairman Hawkins, members of the committee, Chair Dempsey and I have had conversations around this issue for quite some time. And so I'm excited about the possibilities. Just to tell you from the DFAC standpoint, one of the lines in the bill, it was in line 117 of the old bill. It may have changed a little bit, but one of the requirements of the bill is for each state agency to identify and submit to OPB a couple of issues that we could research. And so I went ahead today and just kind of wrote a couple down that I had on the top of my mind. One is we can use this sort of data system to determine how the data that's held by other public agencies can be integrated into our own child welfare data system to triage the complaints as they come in. As you can imagine, we get over 140,000 complaints of child abuse and neglect each year. And were we to have access to more data after those calls come in regarding the child's birth record, the child's birth circumstances, perhaps data indicating whether the parent is under supervision from the Department of Community Supervision, other agency data that we could easily, I think, under modern technology, integrate into our own system, then we could respond in a much more sophisticated way to the needs of these families and really prioritize the cases that need to be prioritized much more quickly and I think achieve better outcomes. Secondly, what a number of other states have done with data like this, cross-agency data like this, is to look at the costs of serving children across agencies and to look at the needs of families and children who are served by different agencies. So, for example, in DFACS, we work with a lot of children who have behavioral health issues, developmental disabilities, who may be on an individualized educational plan at school, who may be served, of course, through hospitals or on Medicaid. And the more that we could correlate the data across agencies to find out about the needs of those children, the more our researchers, and I think our own internal folks as well as university researchers using appropriate de-identified data, could determine better ways to serve those families that I really believe would save us money in the long run, as well as produce better outcomes for children. So that's my take on this bill, and I think I'll be happy to answer any questions if you have them. But the chair, it's back to you.
So I believe that y'all received some information from your chairman, Chairman Hawkins, to give you a little preparation for this. And I hope that you read, I believe this was in the information you sent out. A goal for our state will be now the mark that was set by the state of Michigan. They will have been able to save approximately $1 million per day over the last 7 years of real cost savings. That's real dollars in just IT spend. That's very important. I can't even tell you how much that will be helpful to Georgia's budget. But the real reality is that we're going to be able to save lives and direct best practices and best services in a very effective way. If there are any questions, I'm certainly open to.
Well, you do have a few questions, but before we begin, I appreciate your legislation. I can tell your original bill, which was LC 7653, was similar to the bill that you passed last year.
It
passed through
It
the
was.
House. And this bill seems much better than what you had. And if it helps DFACS in any way, that's just enough for us to vote on, just helping DFACS, much less all the other departments. So let's begin with Representative Gilligan. I think you were first.
Yes, and thank you, Mr. Chairman. And I want to thank you very much for bringing this. Of course, you answered my first question right off by telling me what we are trying to address here. But one of the questions I have is, we referred to a bill from last year. Do you happen to remember the bill number?
It was written down on one of
Yeah.
the earlier versions. I should remember. I'll have it for 9. That's right. It was close to the end of the session. Before crossover day. It was close to that time. Probably passed on about day 29 or 28, 27, whatever day we call crossover last year. You know.
Yeah. Well, I appreciate it again, and thank you for that. That's
You're so
really
welcome.
because you answered my questions that I had going into it beforehand, and I have not digested all of this.
Right,
and
right.
I have to apologize for that.
The main differences, I would say, was it was in OPB last year, So that was the same. I'm trying to think. It certainly had the name SIDS instead of
Right.
this new, better, improved name. But it had not had, I would say, the cooperation of OPB. While they were interested in it, we have worked the last few weeks. I've had conversations very frequently with Kelly Farr, and then today we've had work. I have not personally spoken to him, but work with Chevis Polk, who is brand new and has been brought in to work specifically with data projects for OPB. So it's going to be a different way than we've had before, and this is going to be it's been very well vetted, I would say.
I appreciate you. Thank you for bringing the bill.
Okay, the next I had was Representative Clark, I believe. I know your name, I'm just not sure about the lights. Okay, you're ready.
I think I'm 14. Oh,
Yeah.
that's me. All right. Thank you for this, and I'm a data person, so I really do like this idea. The one question that I had, and it's a really, really tiny one. So all of these state agencies are going to feed into this particular system. Is there anything, or is there any language in here to control who has access to this data and how it is used once everything is compiled in one place? Who's actually getting to use and see this data? Because I'm just worried about like privacy and things of that nature.
Absolutely, absolutely, as you should be, and we all should be. OPB will be housing the project. It's not going to happen immediately. For a lot of reasons, it will take money to do it. I think if you look, it's going to take not a lot of time because we need it. I'm very pleased actually with how quickly the agreement has come forward that we need to begin on this. So if you look on line 48, no later than September 1, they will establish an operational Georgia Data Analytics Center that will be capable of securely receiving, maintaining, and transmitting data in accordance with this part and with HIPAA privacy and security standards. So they will be the keeper of the data, and that will be who we will work through. But there will be so many ways we can apply this once it is gathered. And it's not going to be every agency turning over everything. It's going to be, I think, as we need it, things will develop.
It'll be tailored.
Absolutely. But you, as an expert, as it sounds like you are, I am so fascinated with how when you ask the right questions, you're able to get to the exact statistics that you need. I've seen an execution of an opportunity in another state where really looking at the front end to prevent opioid and drug overdoses, waiting until when they have happened, but to target understanding specific areas, all kinds of things that you can do to put resources in the right place to save lives.
Right. Thank you. I appreciate it.
Representative Walensky.
Thank you. Thank you, Chair. Thanks for bringing this bill. Just a quick question. Line 59 says, but transmit de-identified data wherever possible. Can you, just so I understand, provide an example of when it would be de-identified and when it wouldn't?
Well, I think the intent is to make sure at all times that we're protecting privacy that needs to be maintained with it. There are certain clinical applications, I believe, like if we are dealing, like with a child in DFACS care particularly, to understand how many times that child may have been to an emergency room. There will be certain specifics where we're going to need more information rather than just generic information, I would say.
Chair, may I ask two more short
Yeah,
questions?
go ahead.
In terms of a HIPAA release under this, from other states or from what you've seen, is it one HIPAA release that allows any request to any agency to gather the information? Or how would a HIPAA release work under the, this bill with OPB?
Right. Well, if you look up on, I believe it's line 26, in the definitions of HIPAA, it takes care of it, I believe. The Federal Health Insurance Portability and Accountability Act is what it's referring to, and any regulations promulgated thereunder by the United States Secretary of Health and Human Services. So we will have to be in compliance with that. There is no doubt. So where HIPAA applies, it will be applied.
Okay. And one more question, if I may. When a request is made by one agency to another, who has control of whether that request can be granted under this or not?
Well, OPB will be the keeper of the whole thing, so it would come, the request would come from OPB to receive information from the agencies, and they would be the ones aggregating it.
Thank you so much.
Mhm,
Thank you, Chair.
Thank you. Representative Gamble.
Thank you, Mr. Chairman. Madam Chair, I appreciate you talking to me earlier this morning. I guess I'm curious, is there anybody here from OPB that is in the meeting today?
I'm not aware of it. There was a conflict, Kelly Farr.
Oh, there we are.
yay!
Okay.
Hallelujah!
All right,
You're
so
surrounded.
Yes,
so I'm
yes,
I'm
yes.
just going to cut straight to my question, and I'm curious because I'm familiar with OPB from a funding standpoint, and I think of just the budget when I think of OPB. But I realize this gets into data and goes a step beyond just the nuts and bolts of putting together a budget. I know that OPB is called on to look into programs in agencies and to answer questions about the competitiveness of those programs and how they're performing, and to gather data that then comes back to the legislature, the governor's office to look at as they are making decisions. But I guess if this is in place, if you're collecting the data now yourself, would it cut back on the number of the individual, I guess, I won't say investigations, but the amount of data that you're having to go get isolated? If you've got this centralized system in place, are you now able to access data, I guess, easier and process that? I'm just thinking about that from that angle.
Would you go to the mic over here and identify yourself? That'd be great. You can go to the table or the podium.
It's so good to meet you. He's brilliant.
He's brilliant. Congratulations.
Well, hello, everyone. I am Shepard Spark, and I'm the Division Director for Administration and Analytics over at OPB. And to answer your question, yes, what it allows us to do is to basically break down those silos and bring out the data together and help us with what we call decision support. As we start to look at matrices, particularly performance matrices, what we want to do is marry that with fiscal impact as well. But also what the director of DFACS was saying, also it gives us some insight into what is going on also operationally, so we can start to quantitate things and also look at qualitative information and also assign some quantitative analysis to that as well.
Can I ask one more
Yep,
question?
go
In Michigan, or I guess in any of the other states that have done this, have we seen examples where state agencies or divisions of agencies have been merged or consolidated as the result of this information that's been gathered, or am I kind of missing the whole point together? I may be getting down into the weeds a little bit. I don't know.
I'm not quite familiar with that question.
Okay.
Yeah, I'm not aware of merging.
Representative Gamble, I don't know about merging, but I have read a number of studies where state governments have used this data to determine how to align the work between agencies, for example.
Okay.
So one of which, of course, being, for example, the cross-section of children who are receiving like behavioral health, juvenile justice, and child welfare services. So I don't know about merging, but I have seen a lot of scholarly research on the issues of using this type of data to say, okay, we need to align these functions better.
Okay, great. Thank you.
25, is that Representative Frazier? Mm-hmm.
Question is actually, yes, sir. Thank you, Representative Dempsey. I want to support this, but I'm trying to really, truly understand it. This is a vast data analytical system that we're putting in place. And the reason I'm asking is, will this system be able to track constituency problems from all over the state, put them in a big database? And I'm saying to you this because I'm from Augusta, Georgia, and we have a very high rate of HIV. Is this a system that can track this type of information and have it available? Representative Dempsey mentioned the governor needs all of this information to probably provide budgetary process on how he's going to distribute funding. But is this system one of the ones that would track something like that? not just an opioid, but
Cer-
diseases.
Yes, ma'am, certainly. What we will do, we will go agency to agency, of course, look to see what data is available and what data elements is available. And as you just said, we will basically create what is a data warehouse. And we will start to develop reports based off the data that is available. So if there's a data set out there that is of interest to an agency or to the state as a whole, we will certainly put together a report that will reflect those interests.
Mr. Chairman, one final question.
Okay.
I do see the word board on here. Is there a board? Are there a member board that's
Now, are
beside the
you
OPB?
which, you're looking at the latest version,
The governing board.
and where are you seeing
That's on
that?
line 21
Line 21.
on the front. Would this just all be under the auspices of OPB?
I think that you're looking at the old bill.
Yeah, I think yeah.
The new bill, there was in the older bill.
Why do I have an old bill?
Well,
Well, you should have
because we didn't have the new one till just a few
7770S.
minutes ago. There was a board that was
Oh,
in the
health
original
data.
one, and we took it out.
Okay.
We took that out. We had, with the support, I think, and the confidence of OPB backing this up, that was not as necessary.
Okay. Thank you.
Yeah, and I will tell you, because I'm like you, what are the projects that we need? Once this happens, we're all gonna start thinking. And that's it, what we feed in, what we ask, you can direct any kind of information that we actually need to be statistical and to be factual in what we're trying to do. It's gonna be a matter of what we need to feed in and integrate, and then what we ask the question.
And the reason I said that was because once this data is processed, it will determine for me in Augusta, Georgia, where my needs are and
That's
where
right.
I need to maybe find some budgetary help. I'm hoping that this is one of the avenues that I can use.
And you'd have the statistics to
I
back
see a
you
lot
up.
of heads nodding, so I'm
You'd
hoping.
have, you wouldn't be saying, I just want that.
Right.
You'd be saying,
There's a need.
this is fact.
Mhm.
So, yes, it's gonna
Thank
help
you.
all of us.
Thank you.
Representative Wilkerson.
Thank you, Mr. Chairman. Madam Chair, these are, I guess, two just kind of general questions and then one actually substantive question. On line 28, does that need to be capitalized, the Secretary of Health and Human Services? These are kind of just,
Does that need to be capitalized?
yeah, is that the office, the actual office holder? I think in the old bill it was capitalized as well.
Secretary of Health and Human Services is the title.
The title, that probably
I don't know, that can be
I mean, just pointed that out. Like I said, I'm digging
I checked
really
to
deep
find
here,
out.
so.
good digging. I will check and see.
Yeah, if you could just check on that. And then the second piece is, I apologize, I'm an auditor and I've been out of practice for a few days, but on line 16, or line 19, and like I said, this is just a nitpicky thing, we define HIPAA later, but we talk about HIPAA before we define it, so I don't know if that matters at all, but those are my two little, just like I said, just little, we define HIPAA back in, later in the bill. And
In
I don't know if
five,
we,
number
in
five
yeah,
is the
so
pure
I didn't know if
definition
it
of
matters, if
HIPAA.
the order they're in, I don't know if it matters, but I just wanted to throw that out there.
I don't think it does, because the first, that's the second definition dealing with the data, which is how it starts out. If you look at it, the beginning is the data, the project. It moves on through it. It starts with health, and then at that point, it deals with the definition of HIPAA.
Okay. And then the last piece is on line 48, we talk about establishing the office. Is there a budget for that, or is there a fiscal note or anything that
Well,
we need?
if you'll look at the very end of the bill, let me get you to the right line. It tells the different funding possibilities that we can do at this very moment, as we're working on the 20 budget right now. There is not funding, but you can see that there are several ways. I think there are about 5 different ways as a matter, and the last one listed is appropriations through our General Appropriation Act, but there are many federal grants that they can apply for to make this work. So it will be, the date that you're seeing in there, the first question that you had, is the establishment of it. And then they will begin to work to put it together and to find the funding. And, we'll see in the budget process if something can come out now, if we, hopefully, at least by the amended, or maybe by the next year, if Georgia stays healthy, we can be doing more for them as well.
Yeah, I guess this last final, so, but they have to establish the office, and then we'll look for funding, because it says shall, so we have to establish the office, and then even if we don't have funding yet, we have to establish it.
We will establish the office, and
And then look-
I want to say that I have confidence in the fact that we will find the funding.
Okay, thank you.
All right, thank you. Is it Representative McLaurin? I'm not sure, is that you too? Okay, go ahead.
Thank you, Mr. Chairman, and thank you, Madam Chair. Really like the idea of this bill, and I'm new, and the bill is older than I am, so I appreciate being able to take part in the conversation. I see that there's a provision starting on lines 90, I guess, through about 103 that allows for private entities or universities or researchers to potentially have access to data to do either descriptive statistics, performance evaluation. I imagine there's just a ton of uses that this data could offer. What I see here is language that suggests that the project or OPB will have discretion as to when to grant requests, and I see there's some guidelines regarding IRB approval and standards, and of course, obviously, privacy de-identification standards that they'll have to meet, and those all seem like necessary conditions, which is great for any researcher who'd want to use it outside of the state or state agencies. My question is, will the project have complete discretion as to whom to grant access? Is there some sort of, I don't want to say right, because that's maybe too strong, but I'm concerned, these look like limiters, but are we sure that there will definitely be an opportunity for researchers to participate in the project, assuming they meet these standards, or is that completely at the discretion of the project or OPB?
At this point, I would say that OPB is the keeper of it, which is a good, safe place to start.
Right.
We've got to begin. Like all legislative measures and big projects like this, it will most certainly, I would say, evolve. I think we can be a little bit predictable in that it will evolve. But as of today, as we begin, the true authority and responsibility will rest in OPB, and that's a good place to have it.
I appreciate that caution. I would hope that over time it will be a rich resource for our public universities to do program evaluation and help improve good governance. So thank you so much for that.
Absolutely. Thank you.
Representative Walensky?
Mr. Chairman, thank you for letting me ask one more question. Madam Chairman, my only question is regarding, would the Secretary of State have access to all of this information per request?
Should be able to. I mean, he's an agency.
Okay.
And that is what the purpose of this is. I know that our Attorney General has been active. I know you said Secretary of State, but our Attorney General also has been very active in the conversations of the need for data. There have been meetings all throughout the summer to really discuss this, and representatives have been there from just about everyone who needs data, and that's about everyone.
Thank you so much.
You know, I'll say as a practitioner, the HIPAA regulations are very stringent, and there's no one going to be able to go into this system and look up a name and look up a medical history. That will all be protected. Are there any more questions from the committee? Anyone in the audience would like to speak to the bill? Hearing none, do I hear a motion? We have a motion to do pass and a second. All those in favor say aye. Aye. All those opposed? Congratulations, your bill passes. HB 197, and I would say the GDAC is on its way.
Thank
Right?
you.
You're welcome.
Congratulations
SIDS,
to y'all.
right.
That was a big step that we all just took together. Thank you.
Thank you. We're adjourned.